The Erbium laser is going to be our resurfacing laser. That means it is going to resurface the very most superficial layer of skin, or the top layer of your skin. First, we're going to cleanse the face to remove any makeup, SPF, anything the patient may present wearing. From there, we'll apply some lidocaine cream to help numb for about 20 minutes. That really, to me, takes almost all of the pain and discomfort away. From there, we complete the laser, and then post-laser, we apply Aquaphor to the skin. That is to seal it off from the air, help it heal. For this patient, that is going to give her a really healthy and glowing result when her skin heals, because we've stimulated collagen and we've also taken off the old superficial layer of skin and given her a new healthy fresh layer.